You did everything right. You skipped the late-night snack. You fasted for 10, maybe 12 hours. You didn't eat a single thing. And still this morning, your fasting blood sugar came back high. Again, if you've ever looked at that number and thought, how is this even possible? I didn't eat anything. I want you to hear this clearly. You're not imagining it, and you are far from alone. There is a real scientific reason this happens. And most people never get it explained to them, not even in a quick visit to the doctor. So in the next few minutes, I'm going to show you exactly what your body is doing while you sleep, what that high number is actually trying to tell you, and the specific, proven steps you can take to bring it down. Stay with me, because this changes how you'll look at that morning reading forever. Quick thing before we dive in. If you want clear, honest health information that respects your intelligence, consider subscribing. It's free, and it helps this kind of content reach more people who need it. What high actually means first. Let's take the fear down a notch and get clear on the numbers, because a high reading is information, not a verdict. According to the American Diabetes Association, a normal fasting blood sugar is below 100 milligrams per deciliter. When that number lands between 100 and 125, it falls into a range called prediabetes, and a fasting result of 126 or higher, confirmed on more than one test, is how doctors diagnose type 2 diabetes. Here's why that matters. If your number is sitting in that 100 to 125 zone, your body is sending you an early warning while you still have enormous power to change the outcome. This is not the moment to panic. It's the moment to pay attention. The dawn phenomenon, the big reveal. Now, the big question: how can your blood sugar be high in the morning when you haven't eaten in 12 hours? The answer has a name: the dawn phenomenon. Here's what's going on. In the early hours of the morning, usually somewhere between 3 and 8 a.m., your body starts preparing to wake up. To get you ready for the day, it releases a wave of hormones: cortisol, growth hormone, glucagon, and adrenaline. These hormones send a signal to your liver, and your liver does exactly what it's designed to do. It releases stored glucose into your bloodstream, giving you a built-in shot of energy to start the day. In a person whose metabolism is working smoothly, the pancreas answers with just enough insulin to keep everything balanced, and the blood sugar stays normal. But if your body has become resistant to insulin, that glucose your liver released has nowhere to go. It builds up. And that is the high number you see staring back at you in the morning, even though you never touched your fork. Let that sink in. Your fasting sugar isn't high because of what you ate last night. It can be high because of what your body is doing on its own while you sleep. The root cause: insulin resistance, which brings us to the real root of the problem for most people: insulin resistance. Think of insulin as a key. After you eat, your pancreas releases insulin to unlock your cells, so glucose can move out of your blood and into them for energy. With insulin resistance, those locks get stiff. The key doesn't turn easily anymore, so your pancreas works harder and harder, pumping out more insulin to force the doors open. For a while, it keeps up, but glucose starts lingering in your bloodstream, and your fasting number creeps upward. The hard part is that this happens silently, often over years, with no obvious symptoms. By the time it shows up on a fasting test, the process has usually been underway for a long time. That high reading might be the first clear signal your body has managed to send you. And the good news hidden inside that is this: now you know, while there's still time to act. Other contributors: insulin resistance is the main driver, but a few everyday things can push your morning number even higher. Poor sleep is a big one. Even a few nights of short or broken sleep can measurably reduce your insulin sensitivity. Chronic stress is another, because stress keeps cortisol elevated, and cortisol raises blood sugar. A heavy, carb-loaded dinner late at night can carry over into the morning. A lack of movement during the day adds to it, and certain medications, like steroids such as prednisone, can raise glucose as a known side effect. Notice something about that list. Almost every item on it is something you can influence. The solution and transformation. So let's talk about what actually works, based on solid evidence, not hype. Start with movement, because this one is powerful and almost effortless. A short walk after your meals, even 10 or 15 minutes, helps your muscles pull glucose out of your blood and blunts the spike. Add some resistance training a couple of times a week, and you build muscle, which acts like a sponge for blood sugar and improves your insulin sensitivity over time. Next, look at dinner. Try eating earlier and lighter. and go easier on refined carbs and sugar at night. When you do eat carbs, pair them with protein, healthy fat, and fiber, which slows down how fast that sugar hits your blood. Then protect your sleep. Aim for 7 to 9 hours on a consistent schedule. This isn't a luxury. Good sleep directly improves how your body handles glucose. And find a real way to manage stress, whether that's walking, breathing, prayer, or simply protecting your downtime, because lowering cortisol helps lower your sugar. Now here's the part I really want you to hold on to. In one of the largest studies ever done on this, people in the pre-diabetes range who lost just about 7% of their body weight and moved for around 150 minutes a week, that's just over 20 minutes a day, cut their risk of developing type 2 diabetes by 58%. That result was even stronger than the leading medication. Small, steady changes repeated over time can genuinely change your trajectory. When to see a doctor. One more essential point. Never make big decisions off a single reading. Ask your doctor to confirm with a repeat fasting test and an A1C, which shows your average blood sugar over about 3 months. And please hear me on this. Everything in this video is for education, not a replacement for personalized medical care. Your doctor is your partner in this, so use them. So the next time you see that high number in the morning, I hope you see it differently, not as a sentence, but as a message. Your body is asking for help, and now you know how to answer it. If this helped you understand your health a little better, do 2 things for me. Hit subscribe so you don't miss what's next, and leave a comment with one change you're going to start this week. I read them, and your words might be exactly what someone else needs to see. Take care of yourself. I'll see you in the next one.